Andy Brown. I'm the Travis County Judge, and in 2022 we were looking at ways to move forward past COVID and invested a lot in our workforce. It had become harder and harder to hire people here at the county as it has across the spectrum of employment. And so we decided to invest in our workers by giving everybody an across-the-board raise of 5% and also making sure that we're not paying anyone at the county less than $20 an hour. So we think, obviously, we see that Travis County is an expensive place to live, and we want to make sure that people who work for us at Travis County, who provide that public service to the community, understand that they're valued and have a wage and a salary that let them afford to live in Travis County. And it's already paid off in the recruiting at the Sheriff's Department and other parts of the county is much easier now. There's more people interested in working here. So I'm really happy that we're able to make that investment. We, again, unanimously worked together to get an 8-week paid parental leave program here at the county. So when people come to work here, if they adopt a kid, if they have a natural birth, if they go through a kinship proceeding, anything that basically brings a new member into that family, they can take up to 8 weeks off that is paid parental leave that we are paying here out of the Travis County funds to make sure that people have at least those 2 months to spend fully paid, having their insurance paid and everything like that, so that the stress of that at least is removed from what I know from personal experience is an amazing time in people's lives. One of those things, frankly, that's increasing since COVID is the incidence of mental health. In our jail, pre-COVID, we had about 21% of the jail population who answered our survey that said they had an unmet mental health need and were in the jail. That has doubled to 45% today. We passed with the budget, I think, $500,000 for a pilot program for a mental health diversion center. And what that really means is we'd need to partner with a hospital or someone that is already providing psychiatric services to see if we could use that $500,000 to get a few beds to try this concept out in Travis County. So people who police pick up that clearly have a mental health need could be taken to one of those 3 beds and given treatment and stabilized. We'd see how that works. Long term, though, it's going to be a much more expensive investment, but we need to find ongoing funds to pay for the operation of the Mental Health Diversion Center. We are able to provide more mental health services, more counseling services up front to victims of gun violence, but also to just people who have mental health needs in the community. We're going to be able to reduce our jail population, and that will not only save the county money, it will also make our community safer.